Sawasdee krab, and thank you for joining us for the evening edition of NBT World Brief right here on NBT and NBT World. Yormi Suraphalautharanarit. The Emergency Flood Operations Center convened at Government House to reinforce a three-tier evacuation plan as southern provinces continue to face widespread flooding. Prime Minister's Office Minister Paradon Prisananantakul stressed that categorizing residents into urgent, moderate, and normal groups helps rescue teams reach those in greatest danger first. The urgent tier covers vulnerable people, such as elderly residents and patients who require immediate transfer to nearby hospitals, while the moderate tier targets healthy residents whose homes are inundated and must be moved to safe zones. The normal tier consists of people who can remain at home but rely on regular deliveries of food, clean water, and essential supplies. Deputy Interior Minister Sakda Vichiansin reported that about 1,000 stranded residents were evacuated yesterday, though some refused to leave their homes, prompting emergency teams to deliver food and water directly. Around 300 water pumps have been installed to speed up drainage, and officials reiterated that Department of Disaster Prevention and Mitigation teams are working at full capacity, noting that affected zones stretch far beyond municipal areas. Meteorological officials told the meeting that rainfall should ease over the next 3 days, with conditions in Songkhla already improving and no additional rain expected today. The center also announced that the number of deaths from the southern flood in Songkhla province alone is at 85, with 55 recorded from the flood zone and 30 were deaths unrelated to flooding. Before the meeting, private sector partners delivered 5,000 relief bags containing ready-to-eat food and consumer products, including items from Sabina and Mac Jeans, for distribution across 9 southern provinces. VACHIRA PHUKET Hospital has activated an emergency support plan to assist flood-affected southern provinces by preparing to receive urgent patients transferred from HATYAI Hospital. Dedicated treatment areas have been arranged, and multidisciplinary medical, nursing, and logistics teams are on standby to ensure rapid and safe care upon arrival. Hospital teams and medical vehicles are being deployed to HATYAI International Airport and the HATYAI Emergency Operations Center to collect critical patients and transport them to Phuket for continued treatment. Support assets include a 6-wheel truck carrying essential supplies and donated goods, 1 boat with an engine for water access, a pickup truck with a rescue team, a patient transport van, and additional medical equipment to sustain both emergency and ongoing care. The coordinated mission is intended to stabilize patient transfers, strengthen regional treatment capacity, and ensure that those requiring urgent attention are moved quickly and safely to secure medical facilities. Relief operations for southern flood victims have intensified as the government's National Coordination Center at the Royal Thai Air Force Museum in DONMUENG expands efforts to gather and dispatch essential supplies. Deputy Defense Minister Lieutenant General Adun Buntamjarean, who directs the center, inspected operations and thanked citizens and private firms bringing food, hygiene products, and emergency equipment for distribution to flood-affected provinces. The center was set up to coordinate with state agencies and manage donations so assistance reaches communities quickly and comprehensively. Transport support now includes land and sea routes, with plans to operate 3 daily C-130 flights, carrying relief goods, expected to deliver the next shipments by tomorrow morning. Lieutenant General Adun acknowledged public concern over delays, but urged unity, stressing that officials and civil servants remain duty-bound to serve the people, despite logistical challenges. To reinforce on-ground support, the government has ordered all armed forces branches to deploy 9 mobile medical teams moving by road and boat, accompanied by field kitchens, mobile engineering units, and water purification teams. 4 additional specialist units from the Royal Thai Armed Forces Headquarters are working alongside the Department of Disaster Prevention and Mitigation and other agencies. As water levels begin to recede, authorities are calling for donations of cleaning tools and skilled volunteers, with the military providing transport and accommodation so recovery work in southern communities can advance swiftly. More than 7,000 flood victims from HATYAI and nearby districts are now sheltering at Prince of Songkhla University's HATYAI campus, which is operating as a 24-hour evacuation center. The site has set up registration points, donation intake areas, dormitories, and a central kitchen that prepares thousands of meals daily, creating urgent demand for toiletries, bedding, diapers, rice, eggs, dried food, gas stoves, and cooking gas. Donations can be delivered to the Sports and Recreation Building at the PSU Sports and Health Center in HATYAI. Some evacuees have begun returning home as water recedes in certain neighborhoods, with transport assistance provided by shelter vehicles and volunteers. However, the PSU HATYAI shelter remains open around the clock and continues to require support from all sectors to care for evacuees, students, staff, and patients still on campus. Meanwhile, Songkhla Ratchapat University is hosting more than 600 evacuees with capacity for about 1,400 people. The center provides daily necessities and runs a royal kitchen operated by the Friends in Need Pa Volunteers Foundation of the Thai Red Cross to cook meals for flood-affected residents, while additional buildings are on standby if numbers increase. This shelter reports shortages of key items such as bedding sets, clothing, folding beds for older adults and people with disabilities, diapers, and infant formula. Members of the public can donate these supplies directly at Songkhla Ratchapat University at any time to support ongoing relief efforts. The government has set up a media coordination and public information center to manage communications during the southern flood crisis. Prime Minister and Interior Minister Anutin Chanvirakul assigned Prime Minister's Office Minister Supamat Isarapakdi to lead the effort, and both met at Government House to review progress and stressed the need for accurate, consistent messaging. Minister Supamat said the scale of flooding demands a unified system that gathers verified information from all state agencies and distributes it in a single, reliable format to limit misinformation. The center will serve as a national hub for real-time data, drawing updates from the Public Relations Department or PRD, provincial governors, the Department of Disaster Prevention and Mitigation, ISOC, military units, and other relevant bodies, while also receiving public reports via hotline 1111, the DDPM hotline 1784, PRD online channels, government apps, and the Traffic Fondue system. To ensure unified communication, the center will issue a twice-daily one-page infographic summarizing key information, including severity maps, risk zones, shelter locations, donation points, utility status, road access, operations, and restoration work, along with economic relief details and landslide alerts. The infographic will be released at 11 a.m. and 5 p.m. through the PRD and NBT before wider distribution, accompanied by daily press releases based on verified updates. Officials thanked all participating agencies and underlined that coordinated communication is essential as assistance to flood-affected communities continues. And that wraps up this edition of NBT World Brief. You can stay updated with the latest developments right here on NBT and NBT World. And for more stories, simply scan the QR code on your screen to access our full coverage across all media platforms. Until next time, สวัสดีครับ